I'm going to walk you through what I would regard as the 6 central themes of this revolution in science. The first one is that, and this is the most profound, contaminants interact with genes in ways that not only don't reflect current health standards, but also in ways that the traditional scientific tools used to assess toxicity didn't acknowledge. Second, these interactions can take place at extremely low levels. Can you all hear me when I just realized I was shifting away from the mic? Okay, great. Third, exposures in the womb, and this will be a central theme, exposures in the womb can set in motion things that play out over a lifetime. Fourth, these exposures are ubiquitous, everyone experiences them, and they take place in mixtures that can interact in unexpected ways. Fifth, the tools that we have used in toxicology to assess risk are blind to some of these impacts, and especially several that I will focus on. And sixth, there is now emerging a science called green chemistry that's using this science to guide new chemical syntheses to create a wave of new materials that offer opportunities for innovation, both material innovation and economic innovation. We used to think that only high levels mattered because you need a high level to mutate something. You need a high level to kill something overtly. But when you're dealing with changes in gene expression, things happen at low levels. Levels that people commonly experience, levels that couldn't even be measured 20 years ago. The tools that we have used to assess risk are blind to some of the things I've just summarized for you. And I want to ask, well, how is it that regulatory toxicology missed this? And what I would say is that as good a job as they're trying to do, the process of regulatory toxicology depends upon standardized assays, which often are decades old. And you can't deal with some of the phenomena I've summarized today, the cutting-edge academic work is focusing on, with old tools. As scientists now know that as you move up the dose-response curve, the suite of genes that are being turned on and off changes. That's a classic result in endocrinology. That guarantees that you can't predict from high-dose experiments what's happening at low doses, because different genes are being turned on and turned off. And in fact, at this highest dose here, it isn't an epigenetic phenomenon at all. It's overt toxicity. It's killing the tumor. And that doesn't involve changes in gene expression, period. So if you are depending upon assays that are looking at that sort of endpoint, you completely miss the epigenetic phenomena that take place at low doses. And so the big challenge has been, as we've recognized that some contaminants behave like hormones, they follow the rules of endocrinology, not standard toxicology. That's a big deal, and that's where the rubber hits the road with endocrine disruptors. So there's some bad news in this message. A widespread exposure to compounds that interfere with gene expression, sometimes at extremely low levels. It happens. Today's epidemiology and toxicology is ill-equipped to deal with these effects. But there's good news, and I really want to leave you with that message. I cut out most of it early on just to follow Jackie's admonitions. But what this means is that, like I said, if diseases are linked to genes, we now know there may be ways to prevent them through eliminating the exposures that hijack gene expression. But I think we know enough now to start incorporating what we already know in a new generation of precautionary health standards, and also to work with green chemists so the next generation of materials not only provide economic opportunity, but protect health. We can do that. If you look at today's human epidemics, here's a partial list. There are scientific data showing plausible links to endocrine disruptors to virtually every one of those diseases. Now, in the end, we're probably going to learn that endocrine disruption is irrelevant to some of them, because the science is moving along. But some of them, we're going to learn, actually, it is one of the prime drivers. And we need to be using this science to guide policy and to take us into an era in which our kids are healthier. So thank you.
report of proceedings from a workshop in December 1996, European workshop on the impact of endocrine disruptors on human health and wildlife. So it was very interesting to read what was already established and concluded at that point. So I just picked a couple of examples for you here to read in the executive summary. The evidence that testicular cancer is increasing, the endocrine effects seen in wildlife in some areas were attributed to the evidence one had for exposure to endocrine disruptors, but also the need for adequate background data was established, and that a strategy was needed for assessment and monitoring. But also already at that point it was said we need to consider measures to reduce exposure to EDCs in line with a precautionary principle. I would like to conclude the REACH part by just flagging some ideas what we think needs to happen to move from ambition to action. So we think REACH provides the tools which we just need to start using, and one of the examples would be to put chemicals with endocrine disrupting properties into the authorization, on the candidate list first and then either into authorization or restrictions where it makes sense. And also to restrict the use respectively in imported articles, because this currently is still quite a loophole, also with regard to some of the endocrine disruptors which we think we already dealt with, such as nonylphenol, which is restricted here in Europe, but there's quite a lot of potential for example, the use in imported textiles, that nonylphenol is actually still leading to releases in Europe. I would like to conclude by saying that the tools are available. We need to act now, and EU policies such as REACH play a central role in this. And the exposures needs to be reduced. We think that after spending 150 million euro in the EU EDC research strategy, European citizens really have a right to have some outcome, some result of all that money invested into the research. And now we need to act on the findings. So a lot of knowledge is available. Today, CIN 2.0 is launched, and let's get started. We can definitely start acting now, because under REACH it's not required to have a definition established first, because you can, on a case-by-case basis, bring in those chemicals which have endocrine disrupting properties. And we have currently many tests already available, and we heard a lot of the science in Pete's presentation, where you can actually say these chemicals is an endocrine disruptor, and we just need to reduce the exposures. The sooner the better.
Above all, I hope that somehow this policy and regulatory process can be updated in a way that it reflects current scientific understanding. It does not today. And the scientific community, the people who work on endocrine disruption, the scientists and related issues, are deeply frustrated by that, as illustrated by a letter that appeared in Science magazine about 2 months ago, representing 8 scientific societies, all with expertise relevant to endocrine disruption, an open letter to the FDA and the EPA saying, let us help you. We have expertise you don't have. The scientific community is really ready to throw their understanding into this process if there were a way to do it.
The CIN list is working to become a fast track for the most urgent substances of very high concern for authorization. But it also, we want to influence the official REACH candidate list by working with member states and try to influence them and give an inspiration for them for proposing new substances for the REACH candidate list. But one important thing that was not the key message in the beginning, but has evolved during the last 3 years, it's to provide assistance to companies in their substitution work. It's to provide alert on coming regulation, which has been proving quite successful. We have been identifying ahead of the candidate list which substances would appear there. But it also, as an avoidance list, to communicate with the suppliers what substances should you avoid in your products. So, what's new? We have CIN list. Yesterday, the latest version was CIN list 1.1. Sin list 1.1 had CMR substances, we had PBT substances, we had also equivalent level of concern substances with a few endocrine disruptors already in the first sin list. And now we have added specifically endocrine disruptors. And the difference this time is that we are focusing solely on the endocrine disrupting properties of these substances. For the first sin list, when we also assessed equivalent level of concerned substances, EDCs, they were one part of the puzzle, because we took EDC properties, we took biomonitoring information, we took PBT properties, all those things, making one assessment if these substances would fulfill the equivalent level of concern criteria. So that is the difference, and why there are already a few EDCs on the sin list before, and why we have added even more today. And the reason we heard this morning from Pete, why is it so important to add EDCs? We heard that quite clear. EDCs need to be taken care of.
If you think about a typical cosmetic product on the screen, you may think it's quite simple. It's not quite that simple, unfortunately, for people like me. You have many components in the cosmetic product. You have the packaging, you have the labeling, you have the product itself, you have all the chemicals that go into the different components of that we need to consider when we are considering our chemical policy. And then we have the consideration of trying to make that product available in many different markets, and that's always a challenge because you often have overlapping regulatory pressures from different geographies requiring different things. So it's a very difficult challenge for us to compete with. So we look to organisations such as ChemSec and the SIN list to help us understand what is actually happening out there and what we should be looking at and what we should be focusing on. Early identification allows time to substitute, to help us identify alternatives and to plan for strategic substitution. We want to ensure that where we are removing chemicals, we do it in a strategic way, not in a reactionary way. And that ensures that we can continue to keep stock on shelves, we can get our customers keeping to buy that stock, which makes good commercial sense. And also, we reduce the stock recalls and write-offs that we would see otherwise. It helps us to produce a decision-making tool internally, that we have our policies, we have our internal systems that highlight chemicals that can and cannot be used. And it makes it easy to have conversations with key stakeholders and decision-makers about these things. It's much easier to say, I need you to remove this chemical in 3 years' time than tomorrow. So now we have the new SIN list, and we're reviewing that, and we're seeing what we need to take out next.
There are two ways to look at chemical regulation. The first part is from a risk perspective. So for a big company, what is the risk to continue using potential SVHCs that could be regulated in the future? So first of all, mostly for retail and downstream users of chemicals, we think the risks are product phased out and also major supply chain disruptions. For the chemical manufacturers, of course, they face a significant risk of revenue loss, especially if a large share of their revenues come from those potential SVHCs. On the opportunity side, we think that companies investing in finding safer alternatives, having this more proactive approach, versus reactionary approach, are putting themselves in a much better position compared to competitors that are pretty much waiting to see what's going to come on the restriction and registration list of REACH. So REACH is a regulation that's very complicated to understand for investors. So, I mean, among the uncertainties around the regulation are, how many SVHCs will be regulated, how EDCs are going to be addressed by the regulation, and, what investors really care is who will be impacted, when are companies going to be impacted, and what should they look at when, analyzing companies, and what questions should they ask them on this topic. So, for us, that's when the SIN list comes into play. We've been using the SIN list since 2009, and for us, it's currently the most reliable and comprehensive database currently that we can use that will help us identify the most at-risk substances that companies are using. So from there, we look at so which chemicals are currently included in the list and which companies are potentially using the chemicals to measure companies' risk exposure.
If addressing especially the endocrine disrupting substances, it is not always very clear about the definition criteria, test methods, but it might, of course, be linked to the very little knowledge that some have linked to EDCs, especially when we compare to the knowledge of the CMRs that people have worked with for many decades. So it means, I think, a lot if we could move forward, and as it's also done by having a day like this, to identify priority EDCs and to identify also IDC uses. By addressing the uses, it's of course much more likely that we actually address the alternatives in a good way. And very recently, the bisphenol discussion came up, and it became clear that the impact is to a very high degree linked to the thermal paper in cash recepts. And a large investigation was carried out, and it turned out that there are actually alternatives, or at least one company offering alternatives that are, to the knowledge that we have obtained, bisphenol-free. And it's a more expensive solution, but as it also improves the durability and it in that way fits to our longer-term warranties, it was decided to be a good solution to proceed. So, yes, to conclude, we have ambitions definitely to address EDCs, and it's also interesting with the approach to address EDCs for being an EDC and not just for having EDC properties and additional classifications. There's need for clear directions how to prioritize the EDCs in order to work more efficiently. And as always, but maybe even more in this area, the communication along the supply chain is important, because here we are in an area where more education, more knowledge need to be transferred. And formal, informal collaborations cannot be encouraged enough.
Then you have the issues like, I mean, I didn't know until I heard Pete's presentation this morning about customer receipts. I had no idea. But this is something that you, IKEA has acted on. As you say, you found an alternative, even though it's not something that necessarily your public, your customers are clamouring at the door and saying, you've got to do something about those receipts, because I do stick receipts in. I'm very aware of it. Getting your car keys out, you shove the receipt in your mouth. Why have you decided to act on something that probably, I mean, in terms of making business sense, not top of most customers' worries, because most of us don't know about it?
Yeah, we really trusted the long-time perspective. That is what's important, and that gives the trust, and also trying to represent our customers in different ways. Sometimes we have very clear indications from our customers what they want, what they need, and from the debate and media in some countries. But in other cases, we need to think and take it on our shoulders, try to see what is the need and try to represent our customers.
Yeah, we can look at purely at how companies are prepared to regulation, but also, you know, how are they addressing the chemicals that are on the SIN list. For example, like the first version of the SIN list, we didn't look at endocrine disrupting chemicals, and that was a part, I think, that was missing in how we look, you know, at certain industries, like cosmetics, you know, how they are prepared in that regard.
In terms of the definition of an EDC, we look to experts to help advise us which things should be on these sort of lists. There's an awful lot of work gone into producing this list that we heard about today, and I don't think we would be able to generate that amount of research ourselves. So we're very thankful for organisations such as ChemSec for producing that list for us that we can then take to the next level.
Concerning the scale of the problem and the nature of the problem from endocrine disruptors, I think, until proven otherwise, I think the description given this morning about this being the challenge for the 21st century is probably right.
And if we then looking to the 57F, the substances of equivalent concern, where we also have the endocrine disruptors, there it's even becoming more difficult. I heard this morning many times saying we need a definition. Well, there is at least a concept in the World Health Organization where you have a 5-steps approach. The only difficulty is that it's very clear that some people are realizing very well, if you apply this definition, that probably there will be only an extremely limited number of substances that will be defined as being endocrine disruptors.
It makes life easier to have criteria. It makes life easier to have something like a strategy, how to assess endocrine disrupting chemicals and how to decide if they are substances of a high concern. These are two different things, maybe. It makes life easier, but I think we do not need it at the moment to start.
We should not necessarily put all identified endocrine disruptors on the candidate list. We need to look at each individual substance to conclude whether the substance is a problem that needs to be regulated. And if it needs to be regulated, do we then need to put is authorization the right regulation route, or should we restrict the substance, the use of the substance? Should we classify the substance, or should we do something else?
I feel a strong sympathy for companies who find themselves stuck in the middle. Like the I'd say, brave IKEA and Boots who spoke earlier, they're caught between suppliers who are telling them everything is okay, don't worry, you've bought these chemicals for years, they're still okay. On the other side, they have customers asking questions, or they have a new law requiring new information to be out in the public, or under Article 33, they're getting consumer requests about does your article contain a candidate list chemical. Those companies who are in the middle are in great stress, and they're looking for some help. At least the good companies are. And that takes me at the end back to the SIN list, and the power of this list is that it gives a kind of a signal, or a kind of a North Star, something you can steer by, both for the policy arena. So member states, yes, you can step forward and take some of these chemicals forward through the candidate list process, but also some immediate, practical, sensible advice for companies who are trying to improve.
So my last comment would really be, maybe I'm just in much too good mood today, because I tend to see everything very positively. I compare a bit to the fierce debate we've been having over the years with the REACH discussion, where we've been struggling from different positions. I think I see more openings, willingness to make the system work, and also recognizing that we do have different roles in this, and what really will make a difference is that we play out this dynamics. To me, I keep referring back to this dynamics. I love that word, because I think if we were just discussing the ultimate system where we would know enough to make the exact right decision at the right time, we wouldn't do anything. That's just the complexity of it all means that we have to find ways to navigate and not get stuck in really, really bureaucratic and hard discussions that leads nowhere. I think there's been a lot of ideas how to move beyond that today, so I'm really happy. I feel good.